Hello people, welcome to Crazy Farm, and in this video we will look at the various types of adrenergic receptors, their location, and what happens when we stimulate those receptors and what happens when we antagonize those receptors. Broadly, adrenergic receptors can be classified into two types. We have the alpha type and the beta type. An alpha type of receptors can further be classified into alpha 1 receptors and alpha 2 receptors. And similarly, beta receptors can be classified into beta 1 and beta 2 type of receptors. We also have beta 3 type of receptors, but they are less significant, and beta 1 and beta 2 are more important. Now, let us look at the location of these receptors. Alpha 1 receptors. Alpha 1 receptors are present in the blood vessels. They are present in the dilator pupillae muscle in the eye, and they are also present in the urethral sphincter and the prostatic muscles. Alpha 2 receptors are present in the presynaptic membrane. They are actually presynaptic autoreceptors. It's important to remember that stimulation of alpha 2 receptors produces a sympatholytic effect because they act as a negative feedback mechanism. We'll be looking at this in detail later. Now, let us look at the location of beta 1 receptors. Beta 1 receptors are present in the heart. And the way to remember this is that we have one heart. So, beta 1 receptors are present in the heart. Beta 1 receptors are also present in the JG cells of kidney, the juxtaglomerular cells of kidney. Now, let us look at the location of beta 2 receptors. Beta 2 receptors are present in the smooth muscles lining the various organs. They are present in the smooth muscles lining the airways in our lungs. This fact can be remembered by looking at this statement here. We have two lungs. So, beta 2 receptors are present in the lungs. This is a good way to remember. And apart from this, beta 2 receptors are also present in blood vessels, cells supplying the skeletal muscles as well as coronary vasculature. And they are also present in the smooth muscles of the uterus. That's it about the location of these receptors. Now, have a look at this memory trick here. Without AC, it is a bad day, right? This should help you remember the fact that alpha 1 receptor causes stimulation of alpha 1 receptor causes vasoconstriction, and stimulation of beta 2 receptors supposed to cause broncho and vasodilation, right? Now, let us learn about alpha 1 receptors in detail. What happens when we stimulate the alpha 1 receptors? What are the responses that we can expect due to agonism of alpha 1 receptors? Agonism of alpha 1 receptors, which are present in the blood vessels, can cause vasoconstriction and increase in BP. And similarly, vasoconstriction of those blood vessels which are present in the nose helps in reducing nasal edema of the nasal mucosa. And this property is being used in various nasal decongestants. We have various nasal decongestants like oxymetazoline and xylometazoline, which produces vasoconstriction of the blood vessels in the nose and thereby helps in reducing edema of the nasal mucosa by stimulation of alpha 1 receptors. Stimulation of alpha 1 receptors present in the dilator pupillae muscle or the radial muscle causes the contraction of these muscles and therefore produces mydriasis, active mydriasis. And stimulation of alpha 1 receptors or agonism of alpha 1 receptors present in urethral sphincter and the prostatic smooth muscles can cause contraction of these muscles, thereby producing urinary retention. What will happen if an antagonist acts on the alpha 1 receptor? Alpha 1 antagonism produces exact opposite effects of alpha 1 agonism. Right? It will lead to a decrease in BP because of absence of vasoconstriction, and this property is being used by prazosin, terazosin and other drugs which are alpha 1 blockers. And blockage of alpha 1 receptors in the dilator pupillae muscles or the radial muscles can produce passive meiosis, just opposite to the active mydriasis which is being produced here. Antagonism of the alpha 1 receptors which are present in the sphincter and the prostatic smooth muscles can produce relaxation of these muscles, and therefore this property is being used for the treatment of benign prostatic hyperplasia, at least for the symptomatic treatment of benign prostatic hyperplasia, where the urinary retention in BPH can be corrected by giving a drug by the name of tamsulosin, which is an alpha 1A selective antagonist. know a point that this alpha 1A subtype of alpha 1 receptors are present in the prosthetic smooth muscles and the urethral sphincter. So, alpha 1A antagonism by this drug tamsulosin can be used for symptomatic treatment of benign prostatic hyperplasia. Thereby, this drug helps in relieving urinary retention. This diagram here is that of a presynaptic nerve ending, and it is important to note that alpha 2 receptors are present on the presynaptic membrane, and their stimulation will cause inhibition of further neurotransmitter release. As you can see, various adrenergic neurotransmitters are being produced from the presynaptic membrane by fusion of the vesicles, and these neurotransmitters go and act on the alpha 2 receptor here, and stimulation of these alpha 2 receptors produces inhibition of further release of neurotransmitters. Further release of neurotransmitters will not occur. Okay, so this is the reason why agonism of alpha 2 receptors or stimulation of alpha 2 receptors produces sympatholytic effect. In short, alpha 2 receptors act as some form of negative feedback mechanism. Now, let us look at some alpha 2 agonists and some alpha 2 antagonists. We have mirtazapine, which is an alpha 2 antagonist, and it is an atypical antidepressant. And we have several drugs which are alpha 2 agonists like brimonidine, clonidine, tizanidine, and alpha methyl dopa. As you can see here, most of the alpha 2 agonists end with the suffix nidine. They have the suffix nidine, except alpha methyl dopa, of course. And brimonidine causes reduction in aqueous humor production. Therefore, it is used in the treatment of open angle glaucoma. And clonidine is used for reduction of BP. The sympatholytic effects of alpha 2 stimulation by clonidine causes reduction in BP. Tizanidine is an alpha 2 agonist which acts as a centrally acting skeletal muscle relaxant. Alpha methyl dopa is also being used for lowering the blood pressure, and it is preferred in one of the preferred drugs in pregnancy. Now, let us learn about beta 1 receptors. What happens when we stimulate beta 1 receptors? Beta 1 receptors are present on the heart. As we saw earlier, we have one heart, and so beta 1 receptors are present on the heart. Stimulation of beta 1 receptors can cause positive chronotropism, positive inotropism, and positive dromotropism. That is, increase in heart rate, increase in the force of contraction, and also increase in the conduction velocity. In short, it will have a stimulatory effect on the heart. And stimulation of beta 1 receptors in the juxtaglomerular cells increases renin production. And when renin is increased, angiotensin 1 formation will be more. Angiotensinogen will be converted to angiotensin 1 by renin. And this conversion will be more when renin levels are more. And more the level of angiotensin 1, more will be the level of angiotensin 2. And this conversion happens because of the enzyme, angiotensin converting enzyme, which is present in the pulmonary vasculature. Once angiotensin 2 is formed, it stimulates the release of aldosterone from the adrenal cortex, and aldosterone causes sodium and water retention and therefore increases the blood pressure. So, stimulation of beta 1 receptors in the heart as well as stimulation of beta 1 receptors present in the JG cells of the kidney can cause increase in BP. What happens when an antagonist goes and acts on beta 1 receptor? Beta 1 antagonism has the exact opposite effect as agonism. Right, it will produce negative chronotropism, negative inotropism, and negative dromotropism, and therefore causes a reduction in BP. And similarly, they will also have a negative effect on the beta 1 receptors of the JG cells. Therefore, they reduce renin production and decrease the BP. Now, that's it about beta 1 receptor. Now, let us learn about beta 2 receptors. As we saw earlier, beta 2 receptors are present in the lungs. We have two lungs, and therefore beta 2 receptors are present on the lungs. In fact, beta 2 receptors are present in smooth muscles throughout the body, and stimulation of these beta 2 receptors produces relaxation of the smooth muscles. So, what is the action of beta 2 agonism in the lungs? Stimulation of the beta 2 receptors, which are present in the smooth muscles lining the airways of the lungs, produces bronchodilation. And stimulation of beta 2 receptors present in the uterine myometrium causes relaxation of the uterine smooth muscles. And stimulation of the beta 2 receptors present in the smooth muscles lining the blood vessels can cause vasodilation. Mainly, it produces coronary vasodilation and vasodilation of the vessels which are supplying the skeletal muscles. Stimulation of beta 2 receptors which are present in the ciliary body increases the aqueous humor production. Now, let us look at antagonism of beta 2 receptors. When an antagonist goes and binds to the beta 2 receptor, it produces the exact opposite actions. It produces bronchoconstriction, it produces contraction of uterine myometrium, and it produces vasoconstriction. Also, antagonism of beta 2 receptors present in the ciliary body reduces aqueous humor production. This property is being used by several beta blockers like timolol, which are used topically for the treatment of glaucoma. Thank you. That's it for this video. If you like this video, please like, share, and subscribe.